Hello, healthcare consumers, and welcome to Gary and Jay's Healthcare Insider, the program that tries to help make healthcare easier to understand and navigate. We are committed to make healthcare personal. Today's program, Medical Debt. This is the fourth edition focusing on medical debt solutions. Today's program is how to use charity programs to eliminate medical debt. I'm Gary.
I'm Jay.
And we will be hosting today's program. We are not clinical people. We are experienced in the business of healthcare with over 50 years of combined experience. We bring an insider's view of how healthcare works. Our goal is to share our knowledge with consumers. My career spans managing hospital and physicians' revenue cycle operations that include patient admissions, pre-certification, insurance verification, billing, and medical collections.
I was the chief financial officer for several large healthcare systems, and in this role, I came to understand medicine is both a profession and a business. Like any business, costs, convenience, and customer satisfaction are all very important. The healthcare business environment continues to change. Unfortunately, there are many vested interests in the healthcare system, trying to protect the status quo that sometimes is not in favor of the customer or the patient. Our program is intended to help patients navigate these risks. So one of the big risks is identifying medical debt solutions. And let's recap. What is medical debt? Medical debt is debt incurred by individuals due to healthcare costs and related expenses. Medical debt is different from other forms of debt because it is usually unplanned, accidental, or faultless. Medical debt can have negative impacts on households, such as reducing spending on other essential items, preventing them from seeking needed medical care or treatment. Or medical debt can also lead to bankruptcy or other legal issues. Do you have medical bill? If yes, medical debt can indeed be a significant financial burden for yourself or your family. When someone incurs medical expenses that are not covered by insurance, or you do not have insurance, you may end up owing money to a healthcare provider. This debt can accumulate due to various factors such as high deductibles, co-payments, out-of-network charges, or uncovered services, or even interest charges on existing debt.
All right, so let's go ahead and talk about what about healthcare provider charity programs. According to data from the Census Bureau, 19% of American households carry medical debt. One way to reduce medical debt is through the Hospital Financial Assistance Program, known as Charity Care or Indigent Care. What are charity care programs? Charity care programs give free or low-cost medical treatment at hospitals for people who can't pay. This includes all emergency room care. For patients who are admitted, it also includes any inpatient care they need. Nonprofit hospitals in the U.S. must provide charity care in order to keep their favored tax exemption. About 57% of the nation's hospitals are nonprofit. Some of the for-profit hospitals provide it too. Uninsured and underinsured patients may qualify depending on the hospital. How do you get started with applying for charity? By law, nonprofit hospitals must post their charity care policies on their website. The information must include how patients can qualify for financial help, whether the medical care is free or discounted, how the hospital calculates the bill, and how patients can apply for help. The hospitals must state this information in plain English that's easy to read. There's an additional rule in areas where 5% of the people, or 1,000, whichever is less, speak another language. The hospital must publish the information in those languages too. If you are a hospital needing care, you'll want to find out the details about this program as soon as possible. Look for signs in the waiting room or at the patient check-in desk. Ask for any documents for forms you would need. How do charity programs work? Each hospital has its own care policies, eligibility rules, and application process. You might apply for charity care on the hospital website, over the phone, or with a financial assistant or social worker at the hospital. The application will ask for information about your income, expenses, and assets. You may have to provide proof of these items with paperwork such as tax forms, paycheck stubs, benefit information. It usually takes a few weeks to get your results. While the application process is similar at each hospital, each program has its own review and approval process for charity care. So it is difficult to predict whether you will be approved. Here are 3 factors that could make the difference for you. Number 1, income. Is it above or below the federal poverty guideline? When you apply for charity care, most hospitals consider income, family size, and whether you have insurance coverage. Typically, they compare your income to the federal poverty guidelines based on the number of household members. Many nonprofit hospitals will write off or forgive your bill if your hospital income is less than 100% of the federal poverty guidelines. Just to put it in proper perspective, is that for a family of 4, typical in the United States, in 2023, that level was $30,000. In 2024, it's $31,000. So that typically is what an average family is. So that would be the range for your income for you to qualify for a charity program. Patients who earn more than 100% of the limit can still get some cost reductions. For example, the charity care program advertised by the University of the North Carolina Hospitals accepts people who earn 250% of the federal poverty guideline. Unfortunately, though, many hospitals don't help patients get through the process. In a 2019 Kaiser Healthcare report, that 45% of the nonprofit hospitals send medical bills to patients whose incomes would have qualified them for free or discounted care.
Oh, here it is. So steps that you can take for charity care or obtaining financial help with medical bills are pretty straightforward. Let's go through 5 specific steps. First, get a copy of the policy. As Gary just mentioned, each hospital is required to have a written financial assistance policy that's available to you just by asking for it. The policy must provide free of charge and must tell you how to apply for help. You can ask for this policy in your preferred language in addition to English. Secondly, filling out an application form can be a bit challenging. This application form will require information about your income, may include a copy of your last year's tax return, current pay stub, or some itemization of your family expenses, including things like rent, mortgage payments, utilities, credit cards, and other routine expenses. Find out about the process. Ask questions. Ask the provider how long it takes to process the application for your financial assistance. Get answers specifically about any questions you have regarding the application and what happens to your bill between the process and the conclusion of your service. If your provider or facility where you've obtained healthcare services has turned your medical bill over to a debt collector or a collection agency, you need to notify those debt collectors that you have submitted an application for financial assistance from the organization. You can ask them to halt or pause collections while that application is being processed. And then fifth step, follow up with the organization and the billing department regarding the status and completion of the process regarding your application. Now, what's the difference between for-profit hospitals and not-for-profit hospitals? For-profit hospitals may or may not limit or remove any insurance co-payments. They may give you a discount if you do not have insurance, if you ask for it. They may reduce your overall bill based on your income status. They may also give the same percentage discount to any and all qualifying patients. An important part of being informed about your state's specific policies and procedures regarding charity care is very important. Because of recent federal legislation, many states now require some or all hospitals to provide free or low-cost care to patients below certain income levels. That is now regulated through the state. So understanding what each state program and policies are regarding those situations is very critical. For example, Maine and Washington have laws that require all hospitals to offer charity care, whether they're for-profit or not-for-profit. In other states, charity care laws apply only to critical access, rural, public, or nonprofit hospitals. So an example might be New Jersey, which requires only acute care hospitals to offer charity care. Know your state's policies and regulations. In addition, if you're unable to find out this information through the state, there are social service organizations that will be more than happy to help you find this information.
Great, thanks, Jay. Let's talk about, is charity care the same thing as medical debt forgiveness? And the answer to that question is no. Both can reduce your debt burden, but there are important differences. With charity care, the hospital writes off some or all of your charges during the billing stage before your account goes to collections. Applying for or receiving charity will not lower your credit score. Medical debt forgiveness happens after the account is overdue. In these cases, the bill has gone to a collection agency. The collection agency would then settle your account or a fraction of the full balance. If your account goes to collections, don't panic. It's not too late to apply for charity instead of negotiating debt forgiveness. If your charity care application is approved, you can put your money towards the overdue bill. What other rules are there for charity care? Even if you have private insurance or Medicare, you can still apply for discounts on care. In fact, many hospitals require you to approach your insurer first. The hospital might even look into Medicaid eligibility. The insurance plan, Medicare or Medicaid, would be expected to pay their share up front. Charity care funds could then reduce the remainder of your bill. If you receive a big hospital bill that you cannot pay, ask about charity care right away. It is important to start the application process promptly. Otherwise, the hospital may sue you even if you qualify for financial assistance. If you receive a collection notice for Medicare debt, read it carefully. In the state of Washington, for example, the notice must say if you are eligible for charity care. It must also state whether the hospital applied charity care to any portion of your cost. Information like this will help you negotiate a settlement. Remember that you can apply for charity care at any point in the process. What's the bottom line? Charity care can help you keep your medical bills under control. Thousands of hospitals across the United States provide charity care programs. Some of them accept people who earn up to 400% of the federal poverty level. To start the process, talk to the hospital's billing department or check its website to see if you qualify. What do I do if I've been denied financial assistance? If you don't qualify, don't despair. Hospital representatives say patients may be able to repay their bills on a low or no interest installment plan to take out a short-term loan with your partner bank. You may also want to reapply in the future if you take on a new medical bills. After all, your family circumstances and federal poverty guidelines change from year to year. So a denial in the past may not exclude you from having an application accepted in the future. What are the important takeaways? By law, all nonprofit hospitals must provide charity care based on a patient's income. Some for-profit hospitals offer it as well. Many people who qualify for care don't know it is available to them. You can apply for charity care at any point in the billing process, even if the hospital has sent you to collections. With that being said, Healthcare Consumer Navigator Center is your healthcare partner that offers healthcare consumers information to navigate the healthcare maze via our website. The program and takeaway information of this program will be available on our website, www.healthcareconsumernavigatorcenter.com. Remember, this is the fourth YouTube program in this series, several more to follow. Our next program topic will be how to use the No Surprise Act to reduce medical bill and how to negotiate medical debt. This concludes our program of medical solutions, and we hope the program explained medical debt and has answered some of your questions. Thanks.
I didn't do